like a practitioner with less number of patients, he will hope that these 5 people will go and speak to 10 different people. So for him, word of mouth works as a. I think virtual assistant is already there. We have a virtual reception. Your word of mouth, the word of mouth, like the person will speak to 5 people, but your reviews will speak to thousands of people. 24 of them, they have to know all 5 departments. 5 departments to run a successful practice.
Also, there are some traditional doctors. They have built their practice through word of mouth, okay, and they have a very established practice. Do you think they should switch to digital marketing?
An established practitioner should have at least about 15 to 20 walk-in sprints. So what I'm saying is, I've got a friend who is, I don't want to name, he's in Anantapur, and he's seeing about 60 patients a day. 60 to 80 patients a day, and that is somewhere in a rural, not rural place, but it's a good place, Anantapur. And we have place, so I've got friends in, like Chintamani. He's doing about 50, 60 patients a day, so many walk-ins. When I talk to them, they said, where's the time? I have so many patients myself, I don't need digital marketing. So they are, they are very happy because they are having more word of mouth. When you have 30, 40 people coming into a clinic, going to 30 different places and talking about you, that itself is marketing. But in case if it's a small time practitioner who gets only 5 to 8 patients, okay, so what happens is, for him, it becomes word of mouth is more of, I would call it hope. For like a practitioner with less number of patients, he will hope that these 5 people will go and speak to 10 different people. So for him, word of mouth works as a hope. But for a big practitioner, even if 10% of these people will go and talk about him, and that's how he would grow. And he should get into digital marketing, but not to acquire new patients and things like that. Maybe he can use it for remarketing, because he already has a data of so many clients. He would have phone numbers, he will have emails, he'll have so many things. So to keep them in loop, what he can always do is, he cannot go into new audience, because he doesn't need new patients. He can retain the old patients and give them offers, give them a lot of things, and keep them with him, and then the scenario would continue.
So we have a great number of audience, which includes doctors from the rural areas, from abroad, and also freshers. So how can they utilize this digital marketing field, especially the rural doctors?
The audience is everywhere, because today everybody has got a smartphone. People are on their phones to order food, to watch a movie, book my show, everything is there. So it's not that rural doesn't work and things like that nowadays. Only thing is, do your digital marketing according to your audience. Keep it, keep the connect. In case if they speak more of Kannada, keep it in Kannada. There's no harm. I know a doctor who does videos only in Bengalis, because he's in Kolkata and he does video in Bengali, and it's not like, and Bengali audience is huge. Why does everybody want to rank for dentist in India, dentist in Bangalore, dental clinic in Bangalore, So in case if your target audience is like Kasturi Nagar, you can get your reach right here. And then once you get your reach here, you can grow bigger. So is what I suggest. So for digital marketing, first understand your audience, see the geolocation, get your demographics correct. See, in case those kind of people are more of the real estate people, so how much they can afford. Like people, in some places have got a lot of land and they get a lot of revenue and things like that. They have a lot of money, so you can target more of dental implants with them. Okay. But people who go on to factories, or people who go to, who only earn about 35,000, 40,000 rupees, if in case if we start showing them something which is a full mouth implant, you're targeting the wrong audience. So the digital marketing will work at any place as long as you target your right audience, and they would definitely come to you. So because today everybody is searching for a lot of things online, so dentist also they are searching. They are trying to find out, because in Bangalore now we have a lot of people who are coming from other places and studying in Bangalore. They would not know the local language. They would not know so many things. They would have tooth pain, so they are searching for a dentist in this area, in this locality. So you do not know where somebody would find somebody. Maybe a student who is studying in Bangalore who's got tooth pain. Yes.
So you've been into practice for 25 years. Okay. Now, when it comes to future 25 years, how do you think the evolution is going to be from digital marketing to something else?
But digital marketing is growing every day, Prince. You have the iPhones upgrading every year. You have everything upgrading. Like whatever I have seen before. I have no. I think I am the only the last generation who have seen the radio, the Walkman, and CD, and I do not know if you have seen all that, the pagers, and we used to have a lot of things. And after that, is just climbed up like crazy. We have so many things, and now we have AI, we have a virtual assistant, because after the corona, we the internet is even more picked up. So there are a lot of things coming up in the next 25 years. Is a long time which I can predict, but immediately what I am learning, I would definitely be able to tell you that what I am doing in AI. We have Chat GPT, and now they say Chat GPT is gone. We have something else coming next. There are a lot of the other things coming next after Chat GPT is what I am looking at. And the main thing is it's going to be more user friendly. It's like now we have voice commands, and we have like Siri answering stuff for you. You'll have a lot of other things coming up at the AI level after Chat GPT. I think virtual assistant is already there. We have a virtual receptionist also. Even you can go in with a different kind of thing as a dentist, and you can talk online. It doesn't have to be you. There are a lot of things happening as long as the information is sent across. Okay, it just wants to make it user friendly for everybody. The more advanced it gets, there is plus and minus also. So I would say enjoy today, and live today, and keep on learning is what I would say.
Thank you so much for spending your precious time and sharing your entire knowledge so gracefully. So, any final message for our viewers?
Viewers, yes, there are a lot of information in me, a lot of information in Prince. He's doing a wonderful job in terms of just giving so much information to you guys. Just don't take information from me. Implement it. Whatever you want to read up, or whatever tips are there, please do grow. Do not get fake reviews and fake followers and things like that in Instagram. Let's do something genuine, something real, okay? And do practice well and learn. What I'm saying is every day is a learning process, and automatically once you get into the growth phase, as beautiful as what I have mentioned, I want you also to feel the same what I have felt. But believe it. If you believe it, move forward. If this thing it doesn't work for you, it was not true that it will not work for somebody else also. So try it. If it works for you, good. If it doesn't work for you, in case a word of mouth works for you, it's great. It's not that digital marketing only should work for you. But if you do it, find the right people who will guide you, find the the right mentors who can help you. Because until now, in the colleges we studied, we all had mentors. We all had people to teach us subjects, lot of things about whenever we made mistakes and things like that. But once we finish our dentistry, we all come on the open world and say, oh my God, what's going to happen now? It's like the fear factor is there. But there are a lot of people who really want to help, like one is Dr. Prince, I would definitely mention. Okay, and there are books, there are videos, there are right people. Okay, don't get into people who are saying that we'll get you so many leads, so many things, waste your money, lose it, like just like that. Make sure you are clear with what you want at the end result in terms of ROI, because everybody will be looking at, I've set up my clinic, I've invested 10 lakhs, how do I get it back? Is the first question what people ask me. Or I've spent so much money on dentistry, BDS, how do I generate so much of revenue, or how much do I think I should set a target at? There's so many things which people come and ask me, because when I went and met 200 people, this is what people asked me. And because I was also feeling the same, like what am I doing? I'm just sitting here and waiting for patients, and one day it happens, one day it doesn't happen, and then we just go pray. We say, okay, tomorrow maybe there'll be somebody else, and and it's the same scenario. Or when a neighbor gets a patient and you don't get a patient, you say, oh my God, that guy is getting a patient and I'm not. Let's not get into that. Let us, I want you to increase your online presence. Work on how you can increase your online presence, get more reviews, okay, and optimize your Google My Business profile is what I would say the dental practitioner should. And that's that's an ongoing process. You cannot stop. You cannot stop going to the clinic and say the money will generate. It's your online shop. So as your clinic is open, your online shop also should be open 24/7, and we have lot of reviews which work as your word of mouth. The word of mouth, like the person will speak to 5 people, but your reviews will speak to thousands of people 24/7, because that is going to stay there and serve as your word of mouth and things like that. So make sure you always ask your clients for a review. There's no harm in asking. Only when you ask you get, right? So all the best, and we are always here for you. Thank you.
The session for today is concluded, and I hope you have gained ample amount of knowledge in the field of digital marketing. A special thanks to Dr. Deepak Rudramoorthy for sharing his knowledge graciously. But if you have still queries regarding the same topic, please get in touch with me. All the details are given in the description. So this is Dr. Prince signing off. See you in the next episode. Thank you.